Welcome back, guys. It's Dr. Somji
and Dr. Solomon here. Today we're going to talk about hair transplants and how to get scabs off after transplants.
One of the things that you always think about, to take the scab off or not to take the scab off.
Absolutely, and in fact it is the single post-surgery care that will be critical to the survival of your hair grafts as well.
Absolutely. Like, I think that the moral of the story is trying minimizing the scabs forming. So you can't stop those scabs forming, and what happens is that obviously we implant the hair, and around the follicle you get a little bit of ooze of blood, and that's scabs. Now those scabs can become quite dry, and the key of anything is to keep that area moist and scab free, because then you will, by 2 weeks, almost have undetectable signs of a hair transplant. So what we normally say in our aftercare is that you need to spray the area with some of the growth factor solutions that we give, either saline with some growth factors. Spray it once every hour for the first 72 hours. But in addition to that, you need to be shampooing your follicles 3 times a day. Yes, 3 times a day.
And that's immediately after.
That's even immediately. So when they go home on the day of the surgery, like you always tell people, yes, you have to put the shampoo on. And what we normally say is, in that first delicate period, we provide you with 2 spray bottles, one for the spray and one also empty one as well. If you use that empty one, you can put a little bit of the baby shampoo in, or non-paraben-free shampoo into there. Put a little bit of lukewarm water, shake it up, and then spray the foam on. You can also bubble that up into a bowl like you're doing a baby's bubble bath, and then put the foam on that area. Let it set for like literally 10-15 minutes, and then a cup of water, and then just pour that away. Don't obviously put a shower head in the first 3 days, but you need to be doing this shampooing, soaking thing for 3 times a day. In addition, for the first 72 hours, spraying at least every hour.
Why 72 hours?
Well, the first 72 hours are probably the most crucial time periods for adherence of that follicle there. We want those stem cells to attach and embed within their new home. And there's studies to show that the first 72 hours are crucial. So as long as you stick to that, that's absolutely fine. And also, I know when people are sticking to their aftercare. Some people are too gentle with the shampooing, even beyond 72 hours. You don't need to be. At 5 days, you can actually just massage those areas and remove those scabs. And that's the other thing. If you find after 72 hours, if the hair starts falling out, people come back to the clinic saying, oh, can you put this hair back in? No, it's fine. At 72 hours, it's fused. 5 days, definitely fused. If it falls out after that time period, you have not lost your hair. So, I think it's really important to avoid as much scabbing as possible. Sometimes you see massive craters of scabs. People haven't even touched it at all. That's the worst thing that you can do after a hair transplant.
Yeah, and in fact, I had this experience where I thought I was losing all my hair, but in fact, you're losing the hair, but you're not losing the graft. And the graft is implanted, it's firm, it's set in there, and nothing will get rid of it even by tugging it, or by scrubbing it, or by shampooing it.
Yeah, I mean, there's actually a study, a number of hair transplant clinics have actually done this. After a week, they plucked all the hair out, and the hair transplants still grew. If you want to know anything more about hair transplants, including different techniques, the truth about hair transplants, we've got a wonderful series on the channel, so click subscribe. If you like this video, click like. I think it's really useful after you've had a hair transplant, because this is one of the most common questions that we get all the time. If you've got any other questions that you feel like we should really do a video about, just let us know in the comments below.